So I have 5 time points that I want to touch on to give you an idea of how the school has evolved since Chuck Rohde came here as a postdoc in 1964 until 2023 when he sadly left us. But these points are just, instead of kind of doing a long lecture, I just want us to kind of savor these points, and they really illustrate how Chuck exerted a tremendous influence on the school. But also, there is an alternative reality where Chuck didn't stay here. And I'll tell you about that. And that's, I think, very interesting. And it's actually in the new book manuscript. But so the first point is the deans. So Ellen and Lowell Reed are the 2 of the 11 deans in the school's history who were biostatisticians. And Chuck was kind of in between them. And I think there's some interesting connections among the 3 people. So Lowell Reed was dean, during World War II, a tremendous time for public health and biostatistics. And so he was only responsible for the Pearl-Reed population growth curve, which was widely used in calculating, eventually calculating the for the Population Council and Population Association of America, when the concerns about the growing world population came up, it was his work that was kind of foundational to that. And he himself was also, he helped to guide the school toward emphasizing population, and we eventually established the Department of Population Dynamics. So all of that goes back to demography and Reed's work. But not only that, he also was the co-author of the Reed-Frost epidemic curve. So the idea of that bell-shaped curve that kind of comes up and down, that was the Reed-Frost curve. It's a very simple, elegant method of understanding how, as more people become susceptible in an epidemic and then immune, how an epidemic will come and go. And then finally, and I think this is probably his greatest achievement, have you ever heard of a little thing called the International Classification of Diseases, the ICD? He was directly involved in creating this, and he actually, just after World War II, chaired the committees in both the United States and for the World Health Organization that helped to create a uniform global system to classify diseases, injuries, importantly, and causes of death. So even back in the 40s, he was thinking about injuries as part of the information that we needed to collect. Now, of course, that leads us to Ellen. Ellen is a master of health services research and statistical reasoning, and she has used it in powerful ways to inform injury prevention policy and specifically the trauma care system. And she is best known, she's known for many things, but she co-authored the landmark report, The Cost of Injury in the United States in 1989. And she also was lead author on the national study on the costs and outcomes of trauma care. So we have these, 2 towering biostatisticians who are dean and are now of our school. But Chuck was there in between them, and Chuck trained Ellen, and I think she's really, carrying on his legacy, and particularly his really terrific understanding and teaching of statistical inference. The letter. When I came across this, when I was looking through Chuck's papers as I was inventorying them, and I knew they were very, very, very important, and I just went straight to his office to make sure that we preserved those papers. Alan Ross, chair before Chuck, said of him in 1976, Charles Rohde has a good future in this institution. We need him and we like him. but we'll try to keep him here, even though we anticipate hard times in the next few years. Boy, was that an understatement. By 1976, the school was in very difficult financial straits. A lot of federal funding had started to decline, traineeships had started to decline, but biostatistics was perhaps the hardest hit. And so biostatistics had no specific analog within most of the federal health agencies. There was the National Center for the Statistical Information Center. Sorry, I'm blanking on that. But biostatistics faculty were rarely PIs on their own grants. They were serving as consultants, and as Scott Ziegler has so nicely put it, were pollinating the entire school with statistical knowledge, but weren't always getting a lot of credit for themselves or grant funding. They also carried a truly disproportionate amount of the teaching load, and it is no surprise that a large number of our very best teachers in the school's history have been from the Department of Biostatistics, some of whom are in this room. But when Alan Ross wrote this letter, he was writing on behalf of Chuck, one of his star faculty. And he was sending these letters, there's multiple copies of this letter, to statistics chairs at other universities. He was trying to help farm Chuck out. They asked each of the chairs that he sent them to consider, quote, the possibility of Rohde gaining an appointment at your institution. Oh my goodness, that's scary. I'm so glad that didn't happen, but it could have. Ross bluntly stated that because the school was so dependent on soft money, quote, individual faculty are subject to the fads and whims of the federal establishment. And the discipline of biostatistics in particular has not been favored for support of research or training in the last several years. So, and then he also complained, so the EPA had been around only about 6 years at that point, and Ross was saying those money people in the EPA had rejected Chuck's grant proposal, and he had a terrific idea for practical strategies for conducting better water quality sampling. And in fact, composite sampling is what he really became known for, and his effect on the Environmental Health Sciences Department was huge. So as I said, there's a reality where we don't have Chuck Rohde at the school past 1976, but thank God that didn't happen. So the grant. So as we've already heard, the Mellon Foundation made a $1 million grant to the school in 1980 to strengthen faculty recruitment for obvious reasons. So that private funding, and the Mellon also granted a similar amount of money to epidemiology to help start the clinical epidemiology teaching program. So thank you, Mellon Foundation. But these two grants, I think, to biostat and epidemiology were like crucial. It was a shot in the arm. It was multiple shots in both arms to get the school back on its feet. And with D.A. Henderson, who was the dean at the time, Chuck was instrumental in getting that grant. And I would say, I can't prove this, that Henderson was probably looking at Chuck as the successor to Alan Ross as well. And that's exactly what happened. So, in getting these 5 young, very promising statisticians who we'll learn a lot more later, Chuck really mentored, he mentored all of the faculty and many, many, many students. But the way he invested in these 5 faculty's careers has transformed not only the department and the school, but the field of statistics and the field of public health writ large. They have had tremendous impact. And I'm going to give you a quick quote from 2 of them. Scott Ziegler, in an oral history I did with him, said Chuck was a wonderful chair for the young people. He really worked at trying to find good collaborators for us. I think he felt that if you have smart people and get them in good scientific problems, there'll be a mutual sharing of ideas between the scientist and the statistician, and good things will come of that. Absolutely true. Ron Brookmeyer said Chuck was a very important mentor. He and his wife, Sevilla, were extraordinarily gracious to Robin and I, made us feel like family. Everyone in those early years had our best interests at heart and wanted to promote our careers. Do you know that not all of the departments at the school were exactly out to promote people's careers at that time? This could be, at times, a pretty cutthroat school, and there were departments, it depends, but I have always thought of biostatistics as the happiest department in this school. And that is a huge compliment. So the formula. So as a chair, Chuck did some incredibly wise things to assure the future of the department and the school. And one of them was that he convinced, so as I said, the biostats department was teaching a huge amount, but they weren't getting much grant revenue. And so Chuck said, well, that needs to change. And I think he had a pretty good relationship with D.A. Henderson and the other chairs. And so it was Chuck who convinced them that, and he also, I think, was thinking, I am never going to be in Alan Ross's position. I am never going to have to beg other schools to hire my faculty, damn it. He led in implementing these major revisions to the way the school allocated funding to the departments. So he devised a system where the school used, quote, hard money, that was recurring general fund and tuition revenues, and would compensate each department for not how many faculty they had, but how many students they were teaching. That was really revolutionary, and that really supported, because many people thought of the school as basically a research institute with a sort of teaching program attached. But Chuck elevated the importance of teaching, and he literally put his money where his mouth was. Or maybe other people's money, I don't know. But so to help the faculty who were providing this really valuable statistical and social science expertise, because behavioral sciences was kind of in the same boat, Chuck also negotiated to increase this consulting faculty's share of indirect cost recovery. So these changes not only placed biostatistics on a firmer financial footing, they also supported really high quality instruction and strengthened the faculty and the departments that shouldered the majority of the teaching load. This is the fifth and last point, the environment. Chuck was just, he was passionate about the environment and applying statistical reasoning to environmental problems. And I think it matters that he did his PhD at NC State, which was an agricultural and mechanical school. And they had a very good statistics program based not on public health, but on agriculture. And agricultural statistics in the mid 20th century was where it was at. And when I looked at his papers, he had taken just ridiculously copious notes in these classes at NC State, and he had kept them throughout his career. They were that meaningful to him. So I do think that his, going toward environmental problems may have had, been rooted in somewhat in his early experience in agriculture. I also find it really interesting that Chuck was one of the faculty who helped found the Center for a Livable Future, who, of course, CLF was very involved and still is in addressing the public health problems that are caused by the industrial food production system. So, I think there's definitely some meaning in that from Chuck's background. So not only was he chair of the American Statistical Association Committee on Statistics and the Environment, he was on the advisory board of the Journal of Environmental Statistics, and he taught a very, very popular course on quantitative methods in ecology. He was excellent at helping sometimes kind of not too bright faculty in other parts of the university, of course, to design their experiments so that they would actually work. And one of my favorite stories that he told me was that there was a biology professor who, and I guess he was doing ecology research, and he wanted to figure out I will jump ahead and say, basically, he thought that by doing tests on all these different fish eggs, that he could understand the way the temperature of the Chesapeake Bay was affecting the laying and spawning habits of the fish. And Chuck said, so you've got lots and lots of eggs, but how many fish did you take them from? One. Sample size of one. and so Chuck said, yeah, no. So as I mentioned, he was really advanced the methods of composite sampling and adapted them to environmental research, including calculating the environmental lead levels in both soil and household dust. That was incredibly important in our research in the 90s and forward. And determining what happens to the lead dust levels when you demolish a building in the middle of East Baltimore. And he also, he worked with Marie Denier West when she was his advisee on PCB exposure. And that was, in the, I guess, late 70s, early 80s. And so that was really farsighted. And then I think it's also important that both Scott Ziegler and Karen Van Den Roche are also very, environmental statistics is one of their strong points as well. So I think he's really influenced the department in that way. So we've, Karen has done work on bone mineral density and lead levels in women who are living in inner cities. Lead-associated cognitive decline in the Baltimore Memory Study, looking at aging and racial ethnic disparities. And then finally, and most recently, the effects of fracking and concentrated animal feed operations on the health of the communities around them. So I will end by saying, I just can't get past this idea of an alternative reality without Chuck Rohde. And the fact that he stayed, and not only that he stayed, but he fixed a lot of the problems that had almost, put him out of a job here. He was instrumental in guaranteeing the long-term stability of the department and protecting its emphasis on teaching. And he was an incredible mentor. And so I'll leave you with this. When I was looking for different things to put in this presentation, I have this file on my hard drive called Faculty Bioinformation and Oral Histories. And I just decided to do a search for Rohde. And like dozens and dozens and dozens of people, the chairs of international health and epidemiology and faculty in HPM, and of course, environmental health and engineering. He had such a broad impact on the school as a statistical consultant, but also as a really brilliant and creative curator and protector of his department and the school. Thank you very much.